If you have hypotension, you may have fainted a couple of times and may bang your head into floor and may get a head injury. Like hypotension is also a serious thing to look after. Don't neglect it. Just know why you have hypotension, the cause, signs and symptoms it may show, and the treatment. How to manage your low blood pressure condition. Let's find out. Hello everyone, it's Dr. DK again. Today's topic is hypotension. Hypotension is also called low blood pressure. It happens when your body's blood pressure became lower than the normal. The body have not enough pressure upright anymore. The body may collapse. Just like when you stand up, your vision gets a bit fuzzy and you feel a bit lightheaded. You will feel nothing but numb. But the last thing you would remember that you fainted and didn't know what happens to you. That's probably due to hypotension. Because when you stood up, your body hasn't reacted to the changes that occurred fast enough and your blood pressure has gone lower. Your brain will probably feel dizzy. Hypotension means lower blood pressure. Hypotension is a medical term. When the blood pressure of your body reaches lower to 90/60, that means your systolic blood pressure less than 90 mm mercury or diastolic blood pressure less than 60 mm mercury. It is considered as lower blood pressure or hypotension. Low blood pressure is not always a cause of concern. Having low blood pressure is good in most of the time, but if repeatedly it remains low or the pressure reading shows lower than 90/60, it can sometimes become bad sign to your body. If low blood pressure is accompanied by some signs and symptoms, it is recommended to seek for a doctor's advice. It is crucial to understand the causes, symptoms, and treatment of your low BP or hypotension. It can make a person feel tired or dizziness, or sometimes with other symptoms associated with hypotension. Hypotension can be a sign of some underlying condition that can be treated. Let's find out the causes and its treatment. Blood pressure is the pressure exerted by the force of blood pushing against the walls of arteries. It can be known by a measurement of the pressure in your arteries during the active and resting phase of each heartbeat. Top number is the systolic blood pressure, bottom one is the diastolic blood pressure. The systolic blood pressure means it is the pressure that your heart produces when pumping blood through arteries to the rest of your body. Diastolic blood pressure means it is the pressure in your arteries when your heart is at rest between the heartbeats. So, the normal blood pressure of an adult is 120/80 mm mercury with considerably plus or minus 20. That means the systolic blood pressure will consider 120 plus or minus 20 and diastolic will consider 80 plus or minus 20. That means if it is 110/70, it is considered normal. If 100/70, then it's okay. If 96/70, then also okay. But once it becomes either lower than 90 or either lower than 60, then it becomes hypotension. Your blood pressure, high or low, or if normal, is mainly dependent upon many factors like age, sex, race, and the physical activities you are doing. Like in summer condition, due to excessive heat and inadequate hydration of body, hypotension is seen in more number of people. Blood pressure varies throughout the day depending on your body posture, physical conditions, or physical activities like exercises. Heavy workout will result in hypotension if you are not hydrating yourself regularly. Stress level is most common cause seen nowadays. It becomes the major reason of hypotension in young adults due to several conditions. Some of the medicines you took can result into hypotension also. While eating or drinking, your blood pressure varies. So, blood pressure varies from moment to moment that your activity, whatever you do. Health conditions that can cause low blood pressure. Heart problems or heart diseases. This can cause low blood pressure. Pregnancy can also cause hypotension. Endocrine problems. Dehydration, which is mainly due to conditions like diarrhea or vomiting. Blood loss or bleeding conditions also can cause hypotension. Due to severe loss of blood, you can have lower blood pressure due to very severe blood loss. Or any allergy reaction. Stress conditions. Dietary deficiency. So these are some conditions due to which your blood pressure may fall. Certain medications like diuretics, alpha blockers, beta blockers, some anti-Parkinson drugs, antidepressant drugs, PDE5 inhibitors. So, if you are taking these medicines, then you should know that your body may have lower BP. Just check it for periodically, help your body from hypertension. And not only these medicines, other medicines can also cause hypertension. Just look after that and consult your doctor for this. So, when the blood pressure drops from normal, it will accompany it by some signs and symptoms. But sometimes it may not. You may not feel any symptoms. That means as long as you are asymptomatic, you may feel nothing. It will be usual for you. And when it drops severely, you will suddenly feel the symptoms and will faint. So the signs and symptoms seen during hypotension are dizziness, light-headedness. Most common symptoms are light-headedness, dizziness. Then comes fainting. You may faint, you may lose your consciousness or syncope, that means a brief loss of consciousness. You will have blurred vision, your vision becomes hazy, unclear, tachycardia will be there, your pulse rate will be rapid, limb numbness is another important sign of hypertension. Remember, during morning prayer in your childhood or classroom classes, then your limb will numb, you may feel that you are falling, there will be weakness, fatigue, feeling of excessive tiredness. There will also be lack of concentration, unable to stand, and posture instability more while you walk or stairs. While walking on stairs, you will feel postural instability or sudden rise from bed. If you experience any of these symptoms, it is then essential to consult a doctor to determine the underlying cause. No interventions or investigations required for hypertension, except the measurement of blood pressure. The machine is there to measure blood pressure. Both manual and digital machines are there. You can have the digital one at your home and you can measure it by your own. For the most accurate blood pressure measurement, a mercury sphygmanometer is considered the gold standard when used correctly by a trained professional. However, for some home use, digital blood pressure monitor with upper arm cuffs are widely accepted and recommended for their accuracy and ease of use. If any changes, consult a doctor if required. Okay? Measuring your blood pressure regularly or periodically is vital to monitor your health problems. You can do this at home by your own, by a blood pressure monitor or visit a healthcare. Monitors are easy to use with the appropriate readings. It is comfortable and easy to use. The monitor will display the systolic and diastolic blood pressure on the display. Like this, you can track your blood pressure and manage your health conditions. Treatment. How to manage hypertension? Managing hypertension or lower blood pressure involves a combination of lifestyle changes and some medical interventions. One effective treatment is using more salts in food or water. You can use more salt or you can use ORS water, which is considered the best method. Drinking more water, plenty of water can rehydrate you throughout the day. But ORS is accepted as the best method to manage hypertension or low BP. Lifestyle changes. Eat small and low carb meals, drink more water and avoid alcohol. Pay attention to your body positions, like gently move from prone sleeping or squats to a standing position. Don't sit with your leg crossed, exercise regularly. So lifestyle changes like staying hydrated, managing stress, adjusting your diet can help manage hypertension. And it is recommended to better use electrolyte drinks or ORS. It helps to maintain good blood pressure level by replacing the body's supply or essential minerals like sodium, potassium, magnesium that regulates blood pressure. And these minerals play a key role in controlling the balance of fluids of the body. Mostly sports persons use these drinks. So use electrolyte drink or ORS if you have hypertension. In serious or severe condition, IV fluids, intravenous fluids may be necessary. This involves receiving fluids directly into the bloodstream through intravenous route. And the fluid preferred is NS or normal saline. It is the best to treat hypotension. Some medications you can use, although not used, but if necessary, consult a doctor for these drugs. The drugs like midodrine, fludrocortisone, vasopressors like norepinephrine or epinephrine. So these are the management criteria to treat a patient of hypertension. So, managing low blood pressure or hypertension requires a proactive approach by understanding the causes, recognizing the symptoms, measuring the level of blood pressure, and by following the appropriate strategy, you can maintain your well-being. That's all for today, guys. Thank you all.